Hello, and welcome to the Smart Injury Doctors Podcast, the injury market's top program for doctors, lawyers, and insurers who want to gain greater insight on how to improve patient recovery results and deliver better services in the U.S. injury market. Please welcome your host, Dr. Jeffrey Allen Kronk.
Hello, doctors. Today, what I want to focus on are systems are more valuable than skills. Your systems are more valuable than individual skills. Now, recently I was listening to one of my mentors, Grant Cardone, and he made that comment, and I thought, wow, that's so true in the injury market. A lot of injury providers today want to know, hey, how can I start to scale my center? How can I scale? How can I get other people to come in and start to do the work? Well, systems are what allow you to do that. Systems replace skill. So you can have an individual, and maybe you're that individual, and I know I was this individual for the longest time in my career, where I felt like I did everything better than anybody else that I tried to replace myself with as far as a doctor. But I didn't have any systems in place. I didn't have anything in place to help a provider to come in and be able to take over. In the injury space, I cannot think of an easier place to systemize your processes so that it doesn't require skills. It doesn't require as much skill as it requires adherence to the system. So in the Smart Injury Doctors program, we teach doctors, okay, great, we have checklists of exactly what you want to accomplish on day one so that anybody can come in and learn and fulfill the role, right? Exactly what you're going to do in a consult, exactly what you're going to do in an exam, exactly what you're going to do in the x-rays, exactly what information you're going to give the patient, what you're going to communicate about. Day two, what you're going to do, how your ROF is going to go, key things that you have to pick up so that you have a system in place. So that it becomes very, very easy to drop somebody else into it. On that, so you look at the injury space, especially the spinal injury space, there's only 3 injuries that you're going to work up. There's non-disc ligament injuries, which are caught with excessive motion testing. There's disc injuries, which are caught with MRI. And then there's fracture, which is caught with X-ray or CT generally. Sometimes also MRI. But the majority of your cases you're not dealing with fractures. Right? So you're dealing with soft tissue injuries. So the only 2 things you have to work up, and we help you to create a system. We help you to create the system of being able to say, all right, this is what we're doing. Day 1, day 2, day 3. This is the main 5 things, 6 things that we're documenting over and over and over again. These are the main things that we're watching for outcome assessments. Everybody has their own outcome assessments that they're using. This is what we do in re-exams. This is what we do when we release the patient. This is the communication that we're going to have. This is the email series that we're going to send out to the patient. This is the information that we're giving to the patient. This is the information that we want to communicate to the patient. This is the information that we want the patient to be able to communicate out to the general public so that they can start to promote our clinic. This is really easy, and it's just systems. New patient comes in. Great, they're going to get an email series. And that email series is going to talk to them about, okay, what is it that we do here that's unique? What are ligament injuries? Why are they so important? What's the different kind of testing? What happens when you get back a report? What are we looking for? Why do you do regular care? Why do you do 3 times a week care? Why do you do the care that you do? Could the person need more care at the end? We're doing that all in a systemized email series, and we're promoting and educating within the clinic. So it's a system. Now, once you have systems in place, you can have systems in place we have professional follow-up course, and that starts to get you a system of being able to go out and solicit lawyers or solicit doctors to engage in referral relationships, right? But what are you doing? Do you have a system in place that tells you, hey, here's how I'm going to get an appointment with this person? Do you have a system in place that says, these are the 3 things that I'm going to want to have as a takeaway? Do you have systems in place of information that you're now going to systematically feed them? Do you have systems in place that allow you to take free reports and get them out to them? Do you have a system in place that says, okay, what happens when an attorney does your first referral into your center? What happens? Do you have a system in place that says what happens when they resolve the first claim? Do you have a system in place to maintain your relationships once you have them? Do you have a system in place of things that you can do to actually engage a new referral relationship that either needs to be reestablished, so it's pumping again with referrals, or it's one that you're trying to go after and you just can't quite get there? Do you have systems in place? So the easiest thing in the injury market are to start to systemize your practice. Now, the more systemized you make your practice, the easier it is to actually bring other people into work in your practice, and then the easier it is to actually sell your practice if you're ever going to sell your practice. The easier it is to actually replicate your practice and go with multiple clinics if that's something that you want to do. Right? So it's systems that are going to allow you to seriously expand. And if you're not thinking with systems and you're not thinking with, okay, how do I go from, $500,000 in services to $1 million in services? Or if I'm at $1 million, how do I go to 2 million? How do I go to 5 million? How do I go to 10 million? What am I going to need to do? I'm going to tell you what, in order to do that, you are going to have systems in place. And I can think of no better system than the Smart Injury Doctors Spinal Injury Practice Building System, because it is a system. It's a system that says, here's what the doctor has to do. Here's what the staff have to do. Here's what the marketing people have to do. Now, if you are the doctor, you are the staff, and you are the marketing people, then here are the things that you need, here's what you actually need to do. But the more that you systemize your procedures and systemize what you're doing, the more you can expand, the more you can scale. So having systems in place are really important, and having resources in place that help you to systemize are really important. Having things that will reduce the amount of time that you have to spend. When I look into our Smart Injury Doctors Spinal Injury Practice Building Success System, just a free reports area. Just free reports that you can give to imaging center, free reports that you can give to attorney, free reports that you can give to a medical doctor. Now, some of you might get stuck up on, hey, why would I give a free report out to an imaging center? Well, you're going to give it to them to actually show them how to shoot the images, and you're going to get to the actual, you want to use, if you're going for the injury world, you're going to want to be involved with a injury diagnostic imaging center. They do MRIs, they do it on a lean, they deal with attorneys because they have a marketing person, and I want to get what makes me unique to that marketing person so that he's talking about me to the connections with the imaging center. So everything I'm doing is to build my practice, and I got a system in place in order to do it. I've got things that I know that I'm going to do. If I'm going to use an imaging center, this is what I'm looking for, and this is what I'm going to do. And these are the materials that I'm going to give them so that they understand what it is that I'm doing that makes me unique as a doctor in the market. Same with my approach to attorneys, same with my approach to medical doctors, same with my approach to the public, same with my approach to virtually anything. And I'm going to use and try to create a system. So one of the easiest things that we did was we created a staff training program that has all kinds of, and when I say all kinds, it has checklists. Your day one is really important. Your day two, your report of findings is really important. Your day three for catching up on anything you didn't do in day one and day two is really important. Anytime you communicate what your diagnostic imaging results are to your patient is really important. Setting up your patient for long-term care in the first week or two is really important. Your reevals and what you're doing are really, really important. Each one, whether you do 2, 3, 4, 5, 6, they're really important. What you're doing when you release the patient, very important. And that's why we have checklists for everything that we teach a doctor to do. Because systems are key. Systems will overcome a lack of skill. I could take a less than stellar chiropractor and put him or her into a great system, and they're going to shine. So systems are the way to go. And being able to systemize, and anywhere where you can get help with people that can help to show you how to systemize your practice, it just makes it a lot easier. So today what I wanted to do is just kind of riff on systems, and I'm very proud of the systems that we've created for the Smart Injury Doctors Spinal Injury Practice Success System. So those of you that want more information on that, either go to our website at www.smartinjurydoctors.com, or you call us at 800-940-6513. Doctors, I hope this helps. I hope, I want you to get to thinking about systems on each one of these podcasts. They're short, sweet, to the point, and hopefully it helps you with something maybe that you're struggling with, or something that you should be doing, or, it just gives you something that will help you. I very much so appreciate your time and your attention and what you do every day. And I thank you for listening to this podcast. Thank you.
You've been listening to the Smart Injury Doctors Podcast, the #1 audio production show for professionals in the U.S. injury market that want to deliver better injury services to the patients, clients, or insureds they serve. If you like what you heard today, please leave us a review and don't forget to join us on our next program.